Today we are going to discuss regarding reading part A. It's not a session, so it's just like a mock test. So you can do along with me. So we'll just try to complete within the time frame, like in 12 minutes or maximum, yeah, as usual, like 15 minutes. Okay. Hope you all have the materials with you. If you don't have the material, you can just, I'll just share the screen so that you can just listen to it.
Yes, ma'am. We posted in all the batch and comment batch also, ma'am.
Yeah, it's fine. It's okay. Before starting the session, I'd like to thank Almighty God, Father Celine Joseph, and all the admin panel members and the supporting members for this wonderful opportunity. So today we are going to discuss regarding reading part A. Okay, so reading subtest in that part A we are going to discuss, and the topic is psoriasis. So when you will get a reading part A material, what usually you will do?
Give the headings or underline the headings and subheadings.
Heading. So as a medical professional, we know what it is, psoriasis. Okay. So yeah, when you will read the heading, you need to think about that disease condition. Sometimes if we don't know all the conditions, right? So the heading is psoriasis. You have to underline that. Okay. Then text A. So there is this description. I have given the heading. There is no heading at all. So they have given text A. You know, text A, text B, text C, and text D. We will get 4 text, right? So here, in text A, diagnosis of cutaneous psoriasis is usually straightforward based on a clinical appearance. The most frequent presentation is chronic plaque psoriasis. Whether we will read like this?
No, it's taking time.
No.
You just have to skim and you just scan and skim.
Yes.
Scan and skim.
So
Yeah, first of all, we do
it's
skimming.
not scan and skim. It's a skimming. Okay.
Skimming and
So we'll just skim the
skimming and
text.
scan.
Okay. Yeah. So in reading part A, you need to skim the text. We don't have time to scan all this. Okay. We're just skimming the text. So skimming means what? We are just going through like some important words. We know all the strategies. I'm not going to discuss regarding that. Okay. Yeah. So you can just see some disease conditions or some symptoms or some numbers or some body name of the body part or anything like that. Okay. So here cutaneous psoriasis is there. Then we are just going through the paragraph. Okay. Chronic plaque psoriasis, psoriasis vulgaris. So you can just underline that. Then red plaques, silvery white scales, then down, scalp, extensor surfaces of limbs, eczema, tinea, lichen planus, some disease conditions they have mentioned. Okay. Then again here, palmoplantar disease, again a disease condition. Then guttate psoriasis, another type of psoriasis. Some disease conditions they have mentioned. Okay. And some characteristics of the psoriasis, right? So altogether, we can give a heading like description of, it's not only a definition, it's a description, right? So they have just mentioned some types of psoriasis and some characteristics, okay, some disease conditions. So we can just give a heading like description, okay? You can give even another heading as per your knowledge. I'm not saying like you have to give the same heading which I have given here, okay? But as per my knowledge, I have given like, okay, it's a description of psoriasis, fine. Now we are moving to the next text, treatment. So here, adult psoriasis topical treatment pathway. So it's a topical treatment for whom? For the adult psoriasis, okay? So no need to read all these, okay? Because we know it's a treatment and it's a topical treatment. And here they have mentioned like trunk and limbs. So if it is in the trunk and limbs, then like this, you have to give the treatment. Then face, flexors and genitals, they have given another one. So there are 4 steps here. Potent corticosteroid, vitamin D, then some time period they have mentioned like 4 weeks, again vitamin D, potent corticosteroid, the same thing, right? So this side also, they have mentioned mild and moderate corticosteroid, some medication name, then calcineurin inhibitor, 4 weeks. So if this is not going to work, then the next step, we are going to the next step, right? So some steps they have mentioned, that means the treatment. So just to understand that and give the heading like treatment for adult psoriasis. Now we are, so after this table, okay, there are some thing they have mentioned, like a few points they have mentioned. So when you will get a table like this, most of the time they'll mention some points below the table. So it is really important. Usually we will ignore these, okay, but this point, from this point, the questions will be there. Okay, so here they have just mentioned like aim for a break 4 weeks between courses of treatment with potent or very potent corticosteroids. So the gap which we need to give is like 4 weeks they have mentioned here. Then again, topical treatments, non-steroid based psoriasis disease. Okay, then ditranol, alternative to coal tar preparation. So they have just mentioned some treatment here also. Now we are going to read text C. So text C, they have mentioned psoriatic arthritis. Okay. So definitely in this paragraph, they will mention regarding only the psoriatic arthritis. Okay. So they have mentioned here some percentage, age limit, then if we left untreated, what will happen? So regarding the psoriatic arthritis, they have mentioned, and there is a criteria they have mentioned here, CASPAR. Okay, so classification criteria for psoriatic arthritis. So it depends on what it must have: inflammatory articular disease, more or equal to 3 points from the following categories. So they have mentioned some categories here. So current psoriasis, then psoriatic nail dystrophy, then negative rheumatoid factor. So they have mentioned some categories and the description and what are the points. Okay, so in this particular text, they have mentioned regarding psoriatic arthritis. No need to read it completely, but you just wanted to know the general idea regarding the particular paragraph. Okay, now we are moving to text D. Okay, so they have mentioned children and young people, psoriasis topical treatment pathway. So in this paragraph, they mentioned regarding treatment for children and young, right? Area of the body, they have mentioned creams and ointments, then creams and ointments for the non-steroid. So they have mentioned here steroid and non-steroid creams, okay? And the area of the body they have mentioned like face and neck, both hands, scalp, both arms, legs, trunk, groin, etc. So no need to read completely, just get an idea. Okay, they have just mentioned regarding this. Fine. So now we are going to the question. So now you have an idea in which paragraph they discuss regarding what, right?
Yes, ma'am.
Okay, so we'll read the first question. So the first question is, how much psoriasis ointment is required for various areas of patient body? So where we have discussed regarding the various areas of patient's body.
Text D.
Text D, yeah, text D, because they have mentioned regarding all the body parts, right? Where to how to apply, how much to apply, everything they have mentioned. Okay, you can mark your answers. Now, what the skin of a patient with psoriasis looks like. So if you have psoriasis, how the skin looks like. So where it is discussed?
Description.
Text D, yes. Then question number 3. A way of determining whether a patient has psoriatic arthritis. So in which paragraph we discussed regarding psoriatic arthritis?
C.
Yes. Now, the consequences of not treating a disease which patients with psoriasis may go on to develop. That means what? If you are not treating the disease, then what condition may develop?
C.
Then prescribing vitamin D for adults with psoriasis. So vitamin D.
B.
Yes. Now various conditions that may be confused with the psoriasis. So in which paragraph they have mentioned regarding the conditions?
Description A.
Yeah, in A they have mentioned regarding many conditions. We have read that. Now we are going to the questions like 7 to 14. Okay. So 7th one, in addition to the arms and legs, which area of the body is most likely to be affected by chronic plaque psoriasis? So chronic plaque psoriasis, in which text we have discussed regarding this?
Acidification. C.
Yeah. So when you will read a particular question, first thing in your mind is like from which paragraph it is. Okay. So from which paragraph the particular question from. So now we know that it is from text A. So now we have to find out the answer. So which area, that is the question here. So which area is that?
First portion of the text A.
Yes.
Text
So
A. Fourth line.
Skull. The skull.
yes, the scalp, because
Yeah.
they have mentioned here, these may affect any body site, often symmetrically, especially the scalp and extensor surfaces of limbs. So the answer is scalp. Okay, in what, next question is 8th one. In what age range does PSA typically develop in patients with psoriasis? Okay.
Ma'am, text A.
They are just asking the age group.
30 to 50.
30 to 50 years, ma'am.
30 to
Yes.
50.
When they will ask for a age range, definitely that will be a number, right? So
Yes,
even
ma'am.
if
Yes,
you
ma'am.
don't know from which text it is, you can just search for some range of numbers, right? So the answer is 30 to 50.
30 to 50.
Now we are moving to 9th question.
Sorry, ma'am. Do we need to write 30 to 50 years or just 30 to 50?
30 to 50. If it is 30 to 50 also fine. 30 to 50 years of age also fine. Okay. Now, 9th
Thank you.
question. When treating psoriasis with very potent corticosteroid, how long should be left between courses? That means if you are treating with a very potent corticosteroids, the gap they are just asking between the courses. Okay. So from which text it is? Very potent corticosteroids.
Text B below the column.
C.
Ma'am, text B.
Text B.
Below the column.
Yeah, below the column, there is a statement like aim for a break of 4 weeks between courses of treatment with potent or very potent corticosteroids. So your answer is 4 weeks. Okay. Now moving to 10th question. What may be prescribed as an alternative to coal tar preparation? So where we have read regarding coal tar preparation?
Text
Text
B.
B.
Text
Text
B,
B.
ma'am.
Yes, the
Text
answer
B,
is
Diethanol.
yeah, diethanol. So that is also from the like text B below the table, right?
Yes,
Now,
ma'am.
how much non-steroid cream should be prescribed for application to a child's trunk? So
Ma'am,
non-steroid cream
Text
and
D.
child trunk.
D.
Ma'am,
From text D. Yes. So from text D, you need to search for non-steroid cream
400.
and they are asking for the dosage
400 grams.
400. Yeah. Now 12th question. What is the maximum amount of calcipotriol to be prescribed to a 13-year-old per week? Okay. So maximum amount they are asking 13-year-old.
Text D
Ma'am,
below the
Text
column.
D, calcipotriol. So the answer is
5 grams.
75.
75 grams.
75 gram. Yeah. Now, what should be prescribed for a patient with facial psoriasis which doesn't respond to moderate corticosteroids? So moderate corticosteroids, from which text it is?
D, ma'am.
Ma'am,
Text
B.
B,
Text
ma'am.
B. Yeah, text
Text
B.
B, ma'am.
From text B where it is? Because the key word
Ma'am,
here is facial psoriasis.
Facial
Okay.
psoriasis.
Yeah, facial psoriasis means here two columns are there. Trunk and limbs in one column and face flexures and the genitals in another column. So the second column you need to search for your answer. And what is your answer?
Probably
Ma'am,
plus 120
Calcineurin inhibitor.
Yes, calcineurin inhibitor, because in the first column they have mentioned like once or twice daily mild or moderate corticosteroid, okay, applied for maximum of 2 weeks, discontinue if unsatisfactory response or continuous treatment required to maintain control. So what is the next step? Calcineurin inhibitor twice daily. That is the next step up to 4 weeks. Okay, so calcineurin inhibitor is your answer. Now moving to question number 14. What is the maximum percentage? Again, percentage they are asking, that means it's a number, right? So maximum percentage of a young patient's body to which calcitriol, again calcitriol, because in text D, we have read calcipotriol, calcitol, okay. So here calcitriol they have asked, and maximum percentage is
35%.
35%. Okay. Yeah. Now, so we have completed 7 to 14. We're just moving to 15 to 20. Okay. So a patient with a fever in addition to pustules, plaques, and red skin. So they are just giving the characteristics of that particular thing. Fever is there, pustules, plaques, and red skin. May be suffering from what?
Text A, ma'am.
Text A.
Yes, text A.
Generalized pustular
Generalized pustular psoriasis.
Pustular
We have discussed
psoriasis.
regarding many disease conditions over there in text A. So in that fever, pustules, plaques, and red skin, it means it's generalized pustular psoriasis. Now, 16th one, there is less dash of the skin if the patient has palmoplantar psoriasis. Okay. So
Ma'am,
something
text A.
is less.
Text A.
Text A, ma'am.
Okay, text A. In text A, they have what they have mentioned. Scaling is
Ma'am,
reduced at
scaling is
natural
reduced.
sites on genital skin and in palmoplantar disease, right? So there is less reduced scaling is reduced. Here they have mentioned there is less scaling. Okay, so the synonymous language they have used here. Now moving to 17th question. Don't worry, I'll discuss each and every question with you. Okay.
Yes.
17th one, the Caspar criteria. So we have discussed Caspar criteria where in psoriatic arthritis, right? C. Yeah. So move to that particular paragraph and search for your answer. Criteria should be applied to patients who are already diagnosed with something. So if they are diagnosed with this particular disease, then this criteria should be applied for those patients, right?
Yes, ma'am.
Sorry. Yeah. So the answer is
Inflammatory articular disease.
inflammatory articular disease. Now, 18th one. Poor formation of the dash, including pitting, can indicate psoriatic arthritis. So, poor formation of something and including pitting, which indicate the particular psoriatic arthritis. So, psoriatic arthritis means in text C.
Ma'am, text C.
Yeah. So there you have to check in the column. Okay. They have mentioned psoriatic nail dystrophy. So what is nail dystrophy? So the abnormality of the nail on current examination. And in the another column, the description, they have mentioned what? Pitting. Okay. Onycholysis and hyperkeratosis, then pitting. So your answer is poor formation of the nail. Yeah. Now, the 19th question. So the 19th one is, around half of all patients with psoriatic arthritis will have pain in the dash joints. Okay.
Text A.
Almost half of the patient with psoriatic arthritis will have pain where? So psoriatic arthritis, again, we are moving to text C. What they have mentioned there? Affected joints may have asymmetric stress, pain, joint line tenderness, and effusions with approximately 50% of cases. So 50% of cases they have mentioned there. In the question statement, they have mentioned half of all patients. All means it's 100. Half of all means it's 50%.
50%.
So your answer is distal interphalangeal. Your answer? Yeah. Now moving to 20th question. If psoriasis on the flexures fails to respond to a mild corticosteroid within dash weeks, the treatment should be stopped. So if psoriasis on the flexures fails to respond, if it is not responding to a mild corticosteroids within this particular time period, then the treatment should be stopped. So what is the time period they have mentioned there?
Yes,
2
ma'am.
weeks.
Text,
Ma'am, 2 weeks.
2 weeks.
text to be. Yeah, from text to be, where the answer is?
Ma'am,
Last point.
ma'am, flexes
Flexes and
Yes,
deltoids.
once or twice daily, mild or moderate corticosteroid. So they have an the question is like mild corticosteroid. So within the time period they have mentioned is applied for maximum 2 weeks. So if it is not resolving in 2 weeks, then the treatment should be stopped. Okay, so that is the answer. Now, I'll just show one more slide. Okay, then we will discuss all the questions. The same slide from 10 to 14. Could you find out the, could you just tell me whether these answers are right? Yeah. Check the slide over here. Okay, just look into the screen and find out what are the mistakes in this particular, like these particular questions like 10, 11, 12, 13, 14. Any mistakes in these answers?
One spelling mistake.
Spelling mistake, ma'am.
Mistake.
What spelling
And,
mistake?
H is not
DITH.
DITH.
In first place, S is missing.
TH.
DH.
DH.
DITH. The H is missing.
DIDH.
Whether the answer is right, if you are writing like this,
No, ma'am.
will they give you the score?
No, no.
No, ma'am.
Okay. Now, 11th question.
Gram.
No, it should be 400 grams.
400
400
grams.
400 gram. So,
Gram.
yeah, 400 gram. Instead of 400, I've written 100 gram. Why?
Because that's the
Ma'am, non-steroid.
Yes. So when you will read the question, okay, if I am reading how much steroid cream should be prescribed for application of a child's trunk, then my answer will be 100 gram. Okay. So when you will read the question, you should be very careful. Read twice. Okay. Instead of non-steroid cream, if you are reading steroid cream, then your answer will be 100 gram, which is not correct.
Yes, ma'am.
Okay. Now, moving to next question. What is the maximum amount of calcipotriol to be prescribed to a 13-year-old per week?
75.
75.
Why my answer is 30 gram?
75 grams.
Ma'am, 30 years old.
It's a calcitriol.
Yes. Instead of calcipotriol, if I am reading like calcitriol, then my answer will be
30
30 gram. Okay. So usually in exam, like we will be like very tensed. Okay. Most of us, it's quite natural. Okay. So when we will read the question, we'll just see, okay, calci. Again, we'll just move to the, like to the question. Then, okay, to the text, okay, calci. So calcipotriol is there, calcitriol is there. We'll not think about those, okay. We'll just read that and we will write like 30 gram instead of 75 gram.
Yes, ma'am.
These are the common mistakes we usually make, okay. Now, 13th question. What is the mistake here?
inhibitor.
Calcium inhibitor.
If I'm writing inhibitor, whether the answer is correct?
Inhibitor is missing.
No, the
No,
spelling.
Write the
inhibitor is
whole
missing. I know
Complete
that.
answer.
If I am writing inhibitor along with this word, whether my answer is right?
The spelling is wrong.
Yes, I think.
Yes, the spelling is wrong.
Let me see.
Calcium.
No spelling mistake is there.
Yes, calcium is N-E-U-R-I-N. Okay, E is missing and inhibitor is missing. So definitely they won't give marks. Okay, now moving to 14th question. Whether the 14th one is right?
No.
Why?
Yes.
No, no.
Yes, ma'am.
Then what is the answer? If the
35%.
14th one is wrong,
Write without percentage sign. Like
Only 35 needed.
yes.
Hmm?
35 is the answer.
35 only.
No, why?
It's
Only
right.
35?
Percentage is already
Already in the
Even if the percentage is in your question, you can write 35%.
Percent means word in word. We don't remember.
Actually, this
No,
answer
this
is
one
right.
is correct.
The previous slide also which I have shown is 35% only. The answer is 35%. You can write 35% because they asked what is the maximum percentage of the young patient's body. So you can write 35%. It is not wrong. Okay.
It is correct, ma'am.
Yeah. Now moving to 15 to 20. Find out the mistakes here. If you have background distractions, please mute your microphone. Others can continue. Now,
Spelling
15th question.
Spelling mistake, ma'am.
Spelling mistake. What is the mistake here?
generalized.
Yes, generalized. The spelling is wrong. Generalized. Okay. Yeah. Yeah. Now,
ALISSS.
yeah. 17th question. 17th one. Is there any mistake?
Inflammatory. Yes, ma'am.
M is missing.
One M is missing.
M is
Yeah. M is missing. Now, next 19. 18 is correct. Yeah. 19th one.
Yes, ma'am.
No, ma'am. Joint is there. Repeating word.
Ma'am, joint is repeating.
Yeah.
Joints.
Sometimes we may write like distal interphalangeal joints. Okay. Already the joints, the word is there. So if you are writing again, it's a repetition and it's a grammar mistake again. So they won't give you marks. Fine. Now, 20th question, whether it's right?
Yes, ma'am.
Yes, ma'am.
Yes. So why I prepared this one is like to show you what are the common mistakes we usually like make. Okay. So here see diethranol, as you told, the T is missing. This is 100 gram. It's for steroid, not for non-steroid. And this one 30 gram, it's for calcitriol, not for calcipotriol. Then here again spelling mistake and the other one word is missing. That means it is an incomplete answer. If the spelling is correct, then also the answer is incomplete because the inhibitor is not there. So here there is a spelling mistake plus a word is missing. So they won't give you mark. Okay. Now here generalized. So these are the common mistakes we usually like. We will think like, okay, we know the spelling of generalized, but at exam time, we will be in tension and then usually we'll make mistakes. Now, inflammatory again. M is missing, double M. Only if I'm writing one M, they won't give you mark. Whatever is there in your text booklet, the same thing you have to copy and paste. There is no other option for that. 19th one. So distal interphalangeal joints. Already joints is here. So if you're writing it again, it's a repetition so that it's a grammar mistake also, repetition of words. Okay. Now we can just discuss all the questions once again, like the detailed explanation. So here, first question is how much psoriasis ointment is required for various areas of the patient body. So they have mentioned regarding the various areas and the percentage of the cream in the text D. So the answer is D. Okay. Now the second question, what the skin of a patient with psoriasis looks like. So we know that this in the description they have mentioned like how it looks like. Okay. So in text A, they have mentioned what?
Description.
Description.
Yeah, the description, how the if we have the psoriasis, how the skin will be. So they have mentioned in the text A, so the answer is A. Then again, psoriatic arthritis in text C we have discussed, so the answer is C. Non-treating a disease. So the consequence of non-treating a disease, I think some of you have doubt in this. Yeah. So
Yes, ma'am.
here they have mentioned in text C. Okay. So text C they have mentioned. Sorry. If left untreated, okay, the synonyms they have used or synonymous language they have mentioned is if left untreated. If you are not treating, it's untreated. So non-treating in question statement. Sorry, non-treating in question statement, but in the text it is untreated. Both are same, but the words are different. So the synonymous language they have used here. Now, prescribing vitamin D, yeah, we know that it's from B. Then various conditions. Again, they have discussed many conditions in text A. So the answer is A, because cutaneous psoriasis, then palmoplantar disease, glutate psoriasis, generalized pustular psoriasis. So many disease conditions they have discussed in text A. Fine. Now, moving to 7 to 14 question. So again, in addition to arms and legs. So arms and legs. Yeah, here what is the synonymous language they have used? Arms and legs. Instead of arms and legs, what phrase they have used in text A?
Limbs.
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 Yeah, limbs they have
Limbs,
mentioned.
ma'am.
So extensor surfaces of
Extension surface of
the
limbs.
arms and legs. Which area of the body is most likely to be affected by chronic plaque psoriasis? The answer is scalp and
That's
limbs, right? So they have mentioned here arms and legs. Now again, I don't think in the 8th question you have doubt like what age range psoriatic arthritis. So the same text in the text A, 30 to 50 years of age. If you are writing, okay, between 30 to 50 years of age, that is also correct, okay? Or if you're writing 30 to 50, this is also right, okay? Now, if you are writing like 30 to 50 years of age, that is also right.
Okay.
Fine.
Yeah, thank you.
So in these 3 ways, you can write your answer for the question number 8. Now,
Okay, perfect.
when treating psoriasis with very potent corticosteroids, how long the gap between the treatment? So it is 4 weeks. Now moving to question number 10. Again, alternative to coal tar preparation. So they have mentioned here in text B, the alternative to the same word they have mentioned, right? Alternative
Yes,
to coal
ma'am.
tar preparation. So there is no doubt in that. Then 11th one we already discussed, non-steroid cream. When you will read, please read the question properly. It is non-steroid cream, not steroid cream. If you are reading steroid cream, then the answer is different and they will give you mark. Okay. Now, what is the maximum amount of calcipotriol? So there, in some questions, they will ask maximum, minimum, and all. Okay. So here, see calcipotriol. Okay. 6 to 12 years, maximum 50 gram. If
Yes,
it is
ma'am.
over 12 years,
Over 12 years, ma'am.
over 12 years means anything
Ma'am,
which is more than 12. So it is 13 years. It will come in over 12. They didn't mention 13-year-old. They just mentioned over 12. Okay. And your answer is 75 grams because they have asked you the maximum dose of a 13-year-old. Now, what should we prescribe for a patient with facial psoriasis, which doesn't respond to moderate corticosteroids? So, calcineurin inhibitor. Then again, maximum percentage of young patient's body to which calcitriol may be applied. So again, calcitriol, you have to check not more than 35% of the body surface to be treated daily, maximum 30 gram. Don't write 30 gram because they asked you here maximum percentage. Okay, it's not a maximum
If the
amount, it's maximum percentage. Fine.
Ma'am, if the question is what is the maximum percent of young patient body, then what should be the answer?
The answer is 35%. See, they will not ask
35%,
you
yeah,
maximum percent. When it
Okay.
comes in words, they will ask you maximum percentage. Okay, so
Perfect.
there the
All right.
answer will be 35% only.
Percent, yeah. Thank
Yeah.
you.
Now 15 to 20 again. So patient with the characteristics they have mentioned, the description. So in text A, generalized pustular psoriasis. Again, yeah, this is the 16th one is another synonyms they have used. There is less scaling of the skin, but in your text they have mentioned
Reduced, ma'am. Reduced, ma'am.
reduced. Yeah. So in text A, they have what they have mentioned. What is the statement over there?
Scaling is
Reduced.
Madam, reduced.
Scaling is
Reduced.
There is less scaling of the skin if the patient has palmoplantar psoriasis. Okay, so scaling is reduced at flexural sites on genital skin and in palmoplantar disease. So scaling is reduced. That means less scaling. CASPA criteria, again moving to text C. So they have mentioned in text C what it is. A patient must have inflammatory articular disease.
articular disease.
And if it is equal to or more than 3 points. So the answer is inflammatory articular disease. Then poor formation of nail including pitting can indicate PSA. We have already discussed that in the psoriasis arthritis. They have mentioned here nail dystrophy. So poor formation of the nail. Then around half of all patients, that means all means it's like 100%. Half of all means it's 50%. So 50% of all patients with 50% of the patients with psoriasis arthritis will have pain in the distal interphalangeal where the pain is. Then if psoriasis on the flexures fails to respond to a mild corticosteroid, then within 2 weeks, the treatment should be stopped. Yeah. Is there any doubt in this topic? Because yeah, as I told you, we can finish it within 10 or 10 to 12 minutes maximum, this material. It's very easy. And why we took this much time? Because we are just discussing, we are just asking the questions, we are just discussing. Okay, so it took time. Now, if you have any doubts in this particular topic, you can discuss here. See, why I shown this, the slide, the last slide is, these are the common mistakes we used to do in our OET. Then we will think like, okay, if I'm writing like this, I'll think like, okay, I wrote the correct answer. But when I get my result, I'm not getting the score. What is the reason? These are the common mistakes we usually make, okay? So the common mistakes we make is like, we won't read the question properly, okay? We'll be very busy, like we need to finish within 15 minutes, okay? So we'll be in hurry doing something and finally the answer will be wrong. Actually, you can take 2 minutes time to read your paragraphs for all these paragraphs. It's just, sorry, it's not just reading, it's a skimming of the text. So you can just take 2 minutes time to skim your text, okay? Then 2 minutes time to complete your 1 to 6 questions, because we know from which text it is. If you know the sequence of the particular text, it will be very easy to find out the answer. If you don't know the sequence of this text, then it will be difficult. So when you will finish skimming the text, you can write in your text booklet, not in the answer booklet, in the text booklet like this. Description, treatment for adult, just in a short form you can mention, okay? See, psoriatic arthritis, treatment for young and children. So A, B, C, and D, okay? So if you're not remembering the text properly, write it in your text booklet like this. Description. First, A is description, B is treatment for adult, C is psoriatic arthritis, and D is treatment for young and children. Okay, so that it will be, you can just see this description, see this sequence, and you can write the answer for 1 to 6 questions within 2 minutes. Okay. Even this is useful for all your questions, not only for 1 to 6 questions. This is needed for all your questions to find out from which text the particular question from. So again, from 7 to 14 question, you can take 3 to 4 minutes time maximum 4 minutes time. Okay. Within that 3 minutes time, you can complete it. Same for the rest of the questions from 15 to 20.
Again, one more thing, the word including. If you remember, when you scan, you have to look for conjunctions, I said. You remember? Conjunctions and or, and including is a synonym of and or such thing. Including means this and this. So that is another strategy. That's what I said. Whenever there are conjunctions used, giving two things, one of them will be the answer. You can go to any material, you will have that one. At least one question based on that. So here it says nail formation, including pitting. Could you just take me back to that column description? The three things are given. Okay, a list.
Yeah.
Whenever there is a list, normally if there are two things, they will could use a conjunction. If it is a list, since it is given in column, it is put comma. If it is in a sentence, there will be and after pitting. Okay, so one of those lists are or the conjunction, the same criteria here, but since they have columnized it, they have put comma. They haven't put and because they haven't created a sentence over there. So whenever there is a list, be mindful of the list. And definitely one answer should come from there. There'll be a couple of lists, maybe 2, 3, but then as you glance through, definitely after some practice, you will really lock your eyes over there. That's cool. Again, skipping, as Arya ma'am mentioned, you will think you can do it. You cannot do it. Okay, skipping is a very great skill and essential for your success. And skipping is not as easy as you think. You will be just immersing into that question and you will lose the time. So you practice, when you practice, maybe you skip 10 questions. If you have any doubts, skip and go, just for the practice purpose. Then next time, you out of remaining 10, do 5 or 6, then skip 4. Then come back again. If you don't find one, skip again. So skipping has to be practiced. That's a skill. Okay, it's not easy. So jump from, whenever you have a doubt, don't get stuck there. Simply go to the next. Just mark it and go to the next and visit back. That's cool.
Thank you so much, Father, for elaborating it more.
You're welcome.
Please, please check your and spelling mistakes at the end of the then you will get 2 minutes time to check your answers. Okay, so total it is 15 minutes, but you can finish definitely within 12 minutes, maximum 13 minutes. So that you will get 2 minutes time to check your spelling mistakes. So that's why I just shown this slide. Please check your spelling mistakes. Okay.
Thank you, ma'am, for this wonderful session. You explained very well, and it's very easy for me to find the answers.
Thank you, ma'am.
Thank you so much.
You all can be. That shows Arya ma'am is a proof that you all can be such experts. If you have
because
patience.
we usually, how we will do like, okay, have to complete within 15 minutes. Only the thought is that, okay, complete, like I'll complete in 15 minutes. So we'll be very tensed. So just take it as a game. Okay, I'll just find out the words. I'll just find out the answers like that. So that it will be like, okay, otherwise you may feel like it's very hard.
Yeah, otherwise it's very stressful.
Yeah, it's just a game to find out
True.
the answer.
The thing is, like, you never fell in love with someone in your life, I believe. You fall in love, no stress at all. Being together will take away the stress. I can't teach you that, right? Maybe Malik and all innocent, they haven't fallen in love with anyone. So, so you don't understand what it is. See, when you are
I
in
don't
love,
know why it's still stressful for me. I got headache every time.
I can make out from your body language. That's what I said. Yeah. So you ask somebody who has had a love marriage, maybe after loving the guy for 2-3 years, just ask them what is falling in love with. They will say at night or day or this time or that time they want to be together, and just talking or chatting takes away my stress, everything. So also if you fall in love with OET subtests, it
So
simply
mine
takes
was,
away your stress.
yeah, mine was arranged marriage, so I don't,
Yes,
I can't
and
share
I tell
everything.
you, yeah. So you can ask your friends, somebody if they have an experience, they will share it with you. So
Yeah, we'll do that. Thank you
yeah.
for the tip, Father.
Yes. And I tell you, I was the director of a college, premier college for a couple of years. I banned all the teachers. You should never give homework. You have no right over the college time. That's their right. Let them study if they want. Like for the degree program, they had to pay around 4 lakhs. The hostel warden used to complain, Father, they are not sleeping. Make them to sleep at least at 1 o'clock. Just graduates, undergraduates. They used to study because they had fallen in love with. Then I used to tell the warden, you don't know what is falling in love with somebody or something. That's why you complain. They don't feel sleepy when they study because they have fallen in love with their subject, with the campus, with the teachers.